we're going to look at insulin and diabetes in this video. So remember, you've got your pancreas, and this produces insulin. This is the hormone we're interested in, and what that does, it takes glucose in your blood after you've eaten. There's loads of it. It synthesizes it, puts it together and makes a large molecule called glycogen. Right, so that's what insulin does. That's what insulin does there. It takes glucose from your blood when you've eaten. You've got loads floating about extra. It puts it together into a large molecule which is insoluble, and then goes ahead and stores it in the liver and muscle cells. So that's what's happening so far. Now, if you've got a problem with insulin for some reason, you can have a condition called diabetes. So you've got type 1. This is genetic or hereditary. Genetic. And it says here, let me try to, there, type 1 diabetes. It's where your body attacks the cells that produce the insulin. So it's a genetic condition, and it can occur in childhood. Childhood. And there's a danger that can, if it's not controlled, and you have to control this with normally injections of insulin. Injections of insulin. So this is the sort of stuff they want you to write in your answer. You've also got a type 2 diabetes. So type 1, let's give it the full name, diabetes. This is normally to do with lifestyle. So for example, if you're overweight or obese, you lack exercise, you're smoking, all these factors contribute to drinking. And these are lifestyle choices that you can make. You can overcome type 2 diabetes. It normally happens later on in life, because as you get older, you slow down, and if your food habits are poor, you end up with type 2 diabetes. So you can make changes to your life. So you can eat healthier food, quit smoking, and take exercise to sort of help you out with that. Right, there's a few things that let you know that you've got diabetes. Normally you can, the urine is sweet smelling, but there'll be a test. Right, you can do a test from the doctors to let you know that you've got diabetes. The urine is normally, the excess glucose ends up in your urine, so it ends up very sweet smelling. Right. You tend to feel thirsty a lot. So in summary, you've got let's try that. Right. In summary, the insulin controls the amount of glucose in your blood. If something goes wrong, you're going to end up with type 1 or type 2 diabetes. Type 1 is a genetic condition. It can occur in childhood, and you normally end up having injections of insulin. Type 2 is more of a lifestyle choice. It happens later on in life, where you tend to be overweight, or you're smoking, drinking. Right, you can reduce the effects of that, or even eliminate that, by eating healthier, doing exercise. So for example, you'll eat stuff with lower carbs and you'll have smaller meals. But it is difficult, but it can be done. Right, how do you know you've got diabetes? You can carry out a test from the doctor. Your urine normally is sweet smelling. You tend to be thirsty as well, because your hypothalamus detects that your blood concentration of glucose is too high, and then you start increasing the amount of urine produced by your body. Right, you can also check, we need to add this as well. There's one more thing. You can also check using a machine whether you've got diabetes and how much insulin you need to counter that. So what you do is you'll prick yourself with the machine, put it onto the sensor. That tells you what your blood sugar levels are. Once that's done, you can then inject the right amount of insulin into your body to counter that. Right, okay, that's it for now.